Hello everyone present. I am glad to be here in front of you to show you our research. We are a group of 5 professionals from different universities of Ecuador and Mexico with the vision of finding diagnostic solutions and the treatment of the dentomaxillofacial growth and development alterations. I am Dr. Ronald Ramos, Associate Professor, Senior Research Fellow, and Coordinator of the Orthodontics Specialization of the Catholic University of Cuenca. Our research was relationship between intermolar width and tooth bone discrepancy in children, a cross-sectional study. For the dissertation, the research has been divided into IMRD, Introduction, Materials and Methods, Result and Discussion. Okay, for our first point, we have the introduction. It is known that the growth and the development processes are part of the formation of each individual vein. However, the rate of these varies and is present in a particular way because the function of the organisms are conditioned by the maturation degree according to the determined period of life. Once the formation of the face was settled down, the oral cavity is constituted, the same one that is formed by right structures such as bone and teeth, and soft ones such as muscle, tendon, ligaments, and cartilages. In newborns, the gingival pads or edges that allow the accommodation of dental organs and are an important part in the growth and development of the stomatognatic system. After this, the tooth eruption will begin. This dental eruption is a physiological process which allows the positional balance of the teeth within the alveolar cortex in the jaws, both upper and lower. However, within this beautiful natural process, two important parameters intervene. The genetical or internal one, the same as the component inherited from parents, and the environmental or external one, the one that is about the habit or factor of the environment in age of growth. When there is an alteration within the parameter mentioned above, alteration of irregularity starts in all planes of the space of the stomatognatic system, such as open bite, cross bite, vertical and horizontal overbite, among others. Therefore, inequality is generated between the teeth and the dimension of the jaws, result in a possible dental crowing. There is a variety of scientific information on the subject. However, what is the importance of it? The importance lies in the interculturality and the difference of ethnicity worldwide. So that's the big question fit. Does the tooth bone discrepancy and the width of the teeth with the perimeter of the dental arc in Latin America population and more specifically in Ecuador present different characteristics that those report in the study of patients from North America, Europe, Asia and Africa? Based on the above mentioned question, we set out begin this research. As next point, we have material and method. The research was of quantitative type, with transversal analytical relational design and the temporality retrospective. The sample was as convenient and was constituted by 57 study models. The same was that were taken to children from 6 to 10 years old that went to the orthodontic clinic of the Catholic University of Cuenca from Cuenca during the period February-August of the year 2018. The researchers were trained to be the lead author in the analysis of Tanaka Johnson and the measurement of the intermolar within the upper arcada, which minimizes bias error during data collection in the study models. The data was later tabulated in the Excel program, in which the Pearson correlation of coefficient was applied to determine the relationship between the intermolar diameter and the tooth bone discrepancy of the upper arc. In addition to performing the R2 test to identify the value of the line accuracy. Then, result with Dr. Lorenzo Puebla.
This is the results in our research. The dental crowding was found 42% of the models, 38% were minimal, 33% were moderate, and 29 were severe. The mean intermolar, a maximum of 44 millimeters with and 33 millimeters minimum. No significant difference was found in the variation of the maxillary intermolar width with the difficult types of crowding. When evaluation the relationship between intermolar width and the maxillar tooth bone discrepancy, a value of minus 0.004 and R squared. Imagine 0.0021 was obtained, with no correlation between maxillary intermolar width and tooth bone discrepancy. In the group of the study, the models that reported a tooth bone positive discrepancy.
We can find different arch shapes dental. Therefore, it's very important to determine the diagnosis method to calculate what is the available amount of space for correct eruption of pieces and thus reach the appropriate treatment.
Discussion. Negative tooth bone discrepancy or dental crowding was found in 42% of the child population in the sample. Of this percentage, 38 had a minimum crowding, 33% had a moderate crowding, and 29 had a severe crowding. The results differ from the Burgos study, carried in the Chilean children and adolescents. The mean maxillary intermolar width in this study was 40 millimeters, with a maximum of 44 millimeters and minimum of 33 millimeters. In turn, it was observed that there was no significant difference in the variation of maxillary intermolar widths with the different types of crowding, maintaining a standard deviation of plus minus 2 millimeters. Conclusions. The present study showed that there is no statistically significant relationship between maxillary intermolar width and tooth bone discrepancy or maxillary dental crowding, even if it were minimal, moderate, or severe. In addition, the intermolar width, which is one of the key pieces for orofacial development during the childhood and adolescence, attaining a certain degree of transverse continuity of approximately 39 to 40 millimeters. Our recognition and gratitude to Catholic University of Cuenca, Ecuador, and of course to the students of the dentistry career. Thank you so much.